Hello, I'm Dr. Brant Gibson, and tonight I want to talk to you about peripheral neuropathy and one thing in particular, that pain is really only one of the symptoms. So why would I even be talking about that? The truth is, a lot of times with peripheral neuropathy, the reason that people go get treated for their peripheral neuropathy is because they have pain. A lot of times significant pain, pain that is limiting, pain that is disabling, pain that keeps them from being able to do things. But really, that's only one system you should be looking at, one piece of pain that you should be looking at, or piece of the symptoms that you should be looking at. There are multiple symptoms that are really, really problematic. For example, if you have muscle weakness, this can be a huge problem with peripheral neuropathy and actually can lead to a higher level of disability than the pain will. If you have cramping and muscle weakness and so forth, that is a really, really strong symptom of motor peripheral neuropathy, which can be huge. If you have problems where you stand up and you get lightheaded, if you have poor sweating or really, really dry skin and cracking skin and so forth, this can be a huge symptom that indicates a much larger problem, say, than just the peripheral neuropathy pain. If you have an autonomic peripheral neuropathy, that can be more problematic. That could be life-changing because of the way that it affects multiple systems in the body, not just the nerves. So it starts to make it so that your intestines may not be working like your stomach may not be working like it's supposed to, the heart may not be working like it's supposed to, the blood vessels, the expansion and contraction of the blood vessels isn't working like it's supposed to. Basically, you got a lot of systems that start to malfunction if autonomic neuropathy is part of the puzzle of your peripheral neuropathy. But even if you're saying, okay, all I'm looking at is a sensory neuropathy, okay, you don't have pain, that can still be a huge problem if you have no feeling or significantly decreased feeling in your feet because of wounds. Diabetic wounds, for example, are a huge problem with peripheral neuropathy, and a lot of times they don't have any pain. You can also say, okay, what about balance problems? They don't necessarily have pain, but because they don't have the proprioception, they don't have the pressure sensation when they're standing, it can be a big problem and a significantly bigger problem in peripheral neuropathy as far as long-term symptoms. Loss of balance, falling, getting hurt, breaking bones, stuff like that, because of the inability to maintain your balance, a lot of times can be a bigger problem or a longer term problem than, say, the pain. So yes, severe peripheral neuropathy pain is a big issue. The discomfort can lead to distraction and ultimately disability. But motor neuropathy with the cramping and muscle weakness and so forth can lead to a bigger disability. Loss of balance because of numbness, wounds because of numbness, autonomic type neuropathies can all be huge problems. So when it comes to peripheral neuropathy, and especially when it comes to your peripheral neuropathy, it is important that you evaluate and determine all of the symptoms, because it's going to give you a better indication of what you should be treating and how you can get your life back to normal. How you can say, okay, I'm going to live an extraordinary life even with peripheral neuropathy. But you need to know all of the symptoms and all the pieces of the puzzle that should be getting treated. This is Dr. Brant Gibson, and this is your Neuropathy Nugget Day 230, where pain is just one of the symptoms that should be evaluated. You should be looking at all of them.